Hey, welcome back to Not So Complicated, and today we'll be talking about glaucoma drugs, that is open angle and angle closure glaucoma. So let's begin without further delay, right? So it is actually a condition that causes increase in intraocular pressure, and that can happen by two pathways actually. That is by increasing the aqueous humor formation, that is the humor, the fluid present in front of our lenses, and the fluid present inside of our lenses and before retina is actually vitreous humor, right? So it increases by increasing the aqueous humor formation or by decreasing the drainage of that aqueous humor, and that drainage actually happens in two pathways, that is trabecular pathway or uveoscleral pathway. So blockage in any of this pathway can lead to increase in intraocular pressure, right? So let's talk about primary open angle glaucoma actually. So this is the image. You can see the you can figure out the differences between primary open angle glaucoma and angle closure glaucoma, right? So you can see how that happens right in the images there. So talking about the classification of drugs, that is our main focus, and we will be talking about each of them actually. So talking about, is we have talked earlier, that is it is due to increase in formation of aqueous humor, right? So we have to use drugs that decrease the formation of aqueous humor, and the drugs like that are, one of them is beta blockers, and then alpha agonists, right? And then carbonic anhydrase inhibitors. So these are the drugs that decrease the formation of aqueous humor. And the other side, there is increase in drainage. So that is how you treat, right? So there are three group of drugs here too. The first one is miotics, right? And then PGF2 alpha analogs, and then non-selective adrenergic drugs we use like this, right? So let's talk about them individually. So the first one is drugs decreasing the secretion. Number one is beta blockers. So what kind of beta blockers? The examples are timolol, levobinolol, or catiolol. These are non-selective, and also selective beta blockers like betaxolol can be used, right? So they decrease the formation of aqueous humor, and adverse effects of these drugs is actually allergic blepharoconjunctivitis, and they precipitate asthma. You have to remember one of these things, like you have to avoid beta blockers in four conditions, that is A, B, C, D. This is the mnemonics for you. So asthma, bradycardia, congestive heart failure, and diabetes, you cannot use beta blockers, right? So you have to consider this information in your mind. The another one is alpha 2 agonist drugs. These are apraclonidine and brimonidine, to be very specific, and the highlighted portion you can see in apraclonidine is LID, that is green highlighted, right? Why is that? Because it causes a side effect of lead retraction. So LID is lead retraction, and in brimonidine, you can see BR is starting from brain, right? So CNS depression, and I is iridocyclitis. You can remember like that. So these are the adverse effects caused by apraclonidine and brimonidine. And then CNS depression and apnea in neonates are very much common with these two drugs. So they are contraindicated in individuals or patients below the 2 years of age, right? So you have to remember that. So the last class of drug that decrease the secretion of aqueous humor is carbonic anhydrase inhibitors, and these are like dorzolamide and brinzolamide. These two have topical formulations, so you can directly use them in the eyes. And acetazolamide has oral formulation, right? So acetazolamide is, obviously it is used in diuretics also, and it has a very lot of spectrum of functions. It is used in acute mountain sickness to increase the Schreger threshold, obviously, right? So in glaucoma, it decreases the formation of aqueous humors, and the adverse effects are ocular allergy, corneal edema, and they have beta test, and this can increase retinal blood flow. You have to remember this, right? So now talking about the drugs that increase the drainage, right? So the first one is miotics. So these are like pilocarpine or physostigmine and ecothiophat, right? So pilocarpine is short acting, and physostigmine and ecothiophat are comparatively longer acting. So they increase trabecular outflow. As we have talked earlier, there are two kinds of outflow, that is trabecular outflow and uveoscleral outflow. You have to remember these two different pathways for two different drugs, right? So they increase, the miotics increase trabecular outflow actually. And then there are adverse effects of blurred vision, that is due to induced myopia. Obviously this constricts the pupil, and cataract and punctal stenosis. How do you remember these two side effects? Is that miotics, the last two letters of miotics is C and S, right? So C for cataract, and then P is like S is stenosis, that is punctal stenosis, and it is of nasolacrimal duct actually. So punctal stenosis of nasolacrimal duct is a side effect, and they increase the risk of retinal tears. Pilocarpine fluctuates IOP, and why is that? Because it is very short acting, right? So intraocular pressure suddenly decreases and then increases, then decreases and then increases. That is how it fluctuates IOP actually. The second group of drug is PGF2 alpha, that is prostaglandin F2 alpha analogs. The drugs are latanoprost, bimatoprost, tavoprost, trafluprost, and uniproston, right? So this group of drugs are actually drug of choice for open angle glaucoma, primary open angle glaucoma, right? So they increase uveoscleral outflow of the aqueous humor. So the previous group of drugs increased trabecular outflow, right? But this PGF2 alpha analogs increases the uveoscleral outflow of the aqueous humor, and the side effects are again PGF. P is pigmentation of iris, right? So heterochromia iris is also a side effect of this kind of thing, these alpha 2 analogs, PGF2 analogs, right? So the other one is Z, that is growth of eyelashes. So this side effect can be used in a disease called hypotrichosis. So you can use PGF2 alpha analog as a drug for hypotrichosis also, right? And then F is fluid in macula, that is macular edema in aphakics, right? So this is the thing. And DOC for POAIG, I have already talked about it. It is a drug of choice for primary open angle glaucoma. The last group of drug is non-selective adrenergic drugs. These are dipivefrin and adrenaline, right? So they have a lot of functions actually. They increase uveoscleral outflow, they increase trabecular outflow, and they decrease secretion of aqueous humor. So that is how they work. And the adverse effects are conjunctival hyperemia, that is obviously red eye, and ocular allergy. The thing that you have to know, one thing is that in closed angle glaucoma, the definitive treatment is always surgery. But you can use miotics and osmotic diuretics like mannitol before doing the surgery or laser ablation, because you have to remove uh, decrease the intraocular pressure as much as you can, right? So the definitive treatment of closed angle glaucoma or angle closure glaucoma is always surgery. So you have to remember that, right? So that is all for today. Subscribe for more, and thank you for staying with me. Please subscribe. Thank you.